He was about 8 years old when I met him, and he has severe asthma. Prior to FSU College of Medicine having been out in the clinic, he was actually airlifted from the county in a dire emergency state from the asthma. He lives at home with his dad. It's a single parent situation. It's very difficult for Dad to get medical care and to get the prescriptions filled. So when the Dance Marathon funded the nurse practitioner and medical director positions, we were able to provide not only medical care for him, but help him get his medicine, which prevented further asthma attacks. Prior to having the clinic, he had had numerous ER admissions. He was at the emergency room almost on a monthly basis, and he would reach the point of being in a true crisis and have to spend up to 5 days in the intensive care unit from such a severe asthma attack. So when we were able to meet him, teach him about his disease, how to control the triggers, as well as assisting him in getting the medicine, it kept him a much healthier kid, and he did not have any hospital admissions anymore. When he was a little guy, we were seeing him almost every day in the clinic. He would come over and he would get his medicine to prevent the asthma, and we would check on him. He also had a very difficult home life, and we were working with counselors and getting him the social support that he needed as well. And I thought it was so sweet. He used to come to the clinic to check on me and make sure I was doing okay, which was really sweet. Gadsden County has a lot of challenges with chronic health conditions for both the adults and pediatric populations. There are health disparities in the county that we are trying to address, and that's why the College of Medicine has a clinic here. We see children who ironically are at risk because of obesity, and normally you don't think of obesity with poorer communities, but when your diet is poor, you're forced to eat cheap carbohydrates, so that makes the kids obese, further putting them at risk for diabetes, hypertension, heart disease. And those are lifelong problems, so it's not going to go away unless we address the root cause. It is a paradox. We're about 35 minutes from the capital. We see the very poorest of the community. We see kids who live in migrant worker camps who many times do not have adequate running water, adequate food, so absolute health disparities. And it is amazing that 35 minutes from downtown Tallahassee, we could have these developing world problems. I think the Dance Marathon is truly such a gift and such a blessing. The dancers do such a fabulous job working so hard to raise the funds, and I would like for them to know that their efforts really do pay off. They are impacting children's lives at the most basic level. In addition to providing medical care, we also have a clothes closet, and we have food pantries for needy families. So all of their efforts truly make a difference in Gadsden County.